Insurance coding. Introduction to coding. The purpose that we code is to ensure clear and concise communication among all parties involved. This is the provider and the insurance company. It's a translating of healthcare terms and definitions into a predetermined set of numbers and letters. The reason that we code is for tracking the progress of disease, the classification. It groups related diagnoses and procedures. They do it for research purposes. It provides data for research, evaluation, the analysis of medical utilization, and also standardization. It simplifies reimbursement functions. Related terms: UPCODING, choosing a higher service code to attempt to increase insurance payment. You want to be very careful if you try to do this because this could cause your office to be audited. Downcoding, sending in a claim with an old code. The insurance will use what it feels the proper replacement is, resulting in a lower reimbursement. Bundling codes, codes that include multiple services to be at one visit and cannot be charged separately. An example: surgical procedures that have pre-op and post-op all combined into one. Unbundling, separating bundled codes into individual codes for higher payment, must be done properly to also avoid denials and auditing. The first party is the person receiving the benefit. This would be the patient. The second party is the person providing the service. This is the doctor. Third party is the person responsible for reimbursement. This is the insurance company. We have a CMS 1500 form. This is a universal form used for billing insurance companies for services. The Uniform Bill 92 form. This is a hospital claim form, also known as a UB04 form. The importance of accuracy in coding. It's a financial base for the office's revenue. Incorrect codes could result in downcoding by the insurance company and result in decreased payment. Incorrect codes can result in non-payment. Upcoding, accidental or deliberate, could get your office flagged, audited, and the insurance contract terminated, or charges with abuse or fraud as well. Using incorrect diagnosis codes can create a pre-existing condition for the patient. You want to be very careful there. Some coding rules: never guess, always confer with the physician and or the patient's chart. Only code what was done. Be specific as possible. Codes are updated, deleted, and altered annually. Be sure to stay on top of changes by referencing your book and reading the information sent to you by the insurance company. Common coding errors: transposing numbers or letters, incorrect patient information, incorrect subscriber or policyholder information, failing to complete all boxes on the CMS 1500 form, incorrect codes, margins not properly aligned, failure to have proper signatures on form or on file. The CPT codes. This stands for Current Procedural Terminology. It's used to represent services, procedures, tests, etc. that the physician is billing for. It is a 5-digit code series. There is additional 2-digit modifiers if needed to make a service more specific. It was developed by the American Medical Association in 1966, and it's updated every October. It is divided into 3 categories: an index and appendices, references for the use with the book to help with coding. Category 1, all CPT codes. There's 6 major sections. Category 2 is codes are used for tracking performance measures, non-payable codes. Alphabetic, information is collected by HEDIS, the Healthcare Effectiveness Data and Information Set. and used by 90% of insurance companies to change their benefit packages. It's used within Category 1 codes. Category 3 is a list of temporary codes pending by the FDA's approval. It's used for emergency technology and data collection. It's alphanumeric. The 6 sections of the CPT book. The first section is evaluation and management codes. These are used for billing the examination, your office visit, your ER visit, your hospital visit. It's based on new or established patient, the amount of time or complexity involved with the patient visit, the amount of decision making that went into the patient's diagnosis. When choosing the correct E&M code, the physician must meet 2 of the 3 criteria. Anesthesia. Services involving the use of anesthesia, local, general, regional, peripheral, nerve blocks. The codes start with the head and go to the toes. You have surgery, largest of all the sections. Major coding consists from this section, divided into 9 specific body areas: integumentary, musculoskeletal, respiratory, cardiovascular, lymphatic, mediastinum, digestive, urinary, male and female genitalia, maternity, nervous, eye, ocular, and auditory. Radiology. This codes for imaging studies including nuclear medicine and ultrasound. Pathology and laboratory. Codes are used to bill for laboratory work, examination of cells, tissues. Medicine. It's a hodgepodge of information. Codes that are not found elsewhere in the book. Therapeutic and diagnostic evaluation, chemotherapy, dialysis, psychiatric care, IV therapies, immunizations, clot treatments, neurological assessments, phone services, acupuncture, chiropractic care. The index is an alphabetic listing of all services, procedures in the book. It may be located in the back or the front of the book, depending upon the type book you use. The index is used first to look up the code, and then you cross-reference to make sure that you have the precise code. Modifiers. 2-digit numbers added to the CPT code to indicate a more specific information regarding things like that services had both professional and technical components. More than one doctor performed the service. Service was increased or decreased. Only part of the services were performed. There were bilateral procedure was performed. Procedure provided more than once. An unusual event occurred. When a modifier is used to add information to a procedure code, it is added to the code. An example would be your 5-digit code, such as 99214, and then you would have a -21. This indicates that the office visit required more time than is typical for that code. When a modifier is used to explain the inclusion of an additional service or modifier, it's added to the appropriate secondary code, such as you have the 57140 for pelvic examination, and then 00940-23 for anesthesia for vaginal procedure.